start going ahead with certain questions. Okay, so let's go to our first question, which is why your cholesterol is up even though you're eating better. So let's go to the next one. There was a study done in UCLA where they did the heart attack, more than 130,000 people who got heart attack, and 70% people had almost normal cholesterol. So many times people have normal cholesterol, or even if they're eating better, what the standard care is not looking into the chronic inflammation. Now, many times, like we have, and even Brian will say that many times we have got these patients who have got normal cholesterol, they are skinny, and at young age they get coronary artery blockages, and many times we see fatty liver, insulin resistance. There are certain times genetic things. So what we are doing here is we are going up and beyond the standard care. Just look into thyroid function, stress things. So there are a lot of things beyond cholesterol which can give rise to problems. Okay, now I just want to show you this. Like, this is what a standard care lab work. Okay, the person has got a green chit from the cardiologist, from the hospital, because everything is in green. But now this person has got actually a heart problem, has got put in the stent. So when we do the root cause analysis, if you see here, like, the LDL here looks good, but when we do the pattern B, actually small oxidized LDL pattern B has got more risk for actually creating coronary blockages. And if you see, lipoprotein A is also very high. So when we do this advanced type of testing, we can have more data, which is there. So I'll just stop here and let anyone wants to ask questions related to this, or Brian wants to add in, Mark wants to add in. As I told you that this is collaborative.
I would just make the point that about half of patients with heart attacks have LDL cholesterol panels that are considered normal. In fact, there are guidelines, and I know, Mark, you don't love this, but it is. There are guidelines. I'm not saying I believe everything that they say, but they're a good starting place for discussion. And what happens with heart attacks is that cholesterol builds up in your arteries, and then it becomes inflamed, and then that inflamed cholesterol causes all sorts of problems, and it cracks open and forms a heart attack. The guidelines recommend that we treat to an LDL cholesterol, the so-called bad cholesterol, which is a misnomer, but anyway, it's called the bad cholesterol. We want it to be under 100. And so this person that you just showed, Pratiksha, was very low, it's in the 50s, as I think. And that would be a person that we would think was really well treated. But the thing that jumped out to me on that slide is that the lipoprotein little a was so high. That was, to me, a bigger red flag than the fact that they have so-called small particles, the idea is that they can get into your arterial walls more easily than the big particles. Maybe there's some truth to that, maybe not. But the lipoprotein little a was very high. I mean, it was about 3 or 4 times normal. And that's when I have a person who has cardiovascular disease or advanced cardiovascular disease, and quote normal generic regular cholesterol panel, we got to look further. That's when you have to look further. I am a believer in doing these advanced panels in most people, but sometimes you don't need to. I mean, if the regular panel's a mess, you have a mess. You don't need to get into the weeds of mess. You just know you need a lot of work to be done. But if somebody's doing really well, particularly if there's a family history of premature vascular disease and everything looks great, my cholesterol is great, my blood pressure is great, I'm not a diabetic, I'm thin, I'm eating right, I'm exercising, etc. I'm doing all the right things, I'm not a smoker, but my family history is a mess. That's when I really feel that you need to look further. And so the lipoprotein little a in this patient, that was a red flag for me.
And one more question James is asking is that, do statins affect small particle LDL?
They lower cholesterol across the board. They don't preferentially lower small particles more than large particles. They lower them both. But if you have a very high small particle number, it'll come down some with statins, but you still may be elevated even though you're on a statin.
Okay, Joseph, you want to ask something? You have raised your hand.
I do. One thing, those numbers look awfully familiar.
Yeah.
What I wanted to say is I was surprisingly thrown into the cardiology world very early in life, 2011. Before I knew I had a stent. Meanwhile, my numbers were good because I had been taking cholesterol medicine since the age of 30. And yes, I have a huge, all my family has had cardiac problems and cholesterol problems. But from 2011 until I met this group, I've seen, I don't know how many cardiologists, because I travel for a living and I've moved around. No one ever looked into it. They just kept upping my medicine. So I was entirely unsatisfied with just more medicine. And they said, then it came to a point where, hey man, your levels are fantastic. You don't have a problem. I said, wait a minute. I clearly have a problem because I have these levels because I'm medicated. I got to the point here recently that says, well, your cholesterol is too low. That's not good for you. You have to do something about increasing your good fats. So it wasn't until I got this test where I got to understand, okay, so at least now I have an explanation as to what is actually happening. Even though when I asked the next question was, well, what can I do about it? Well, not a lot, other than try to eat better, which I'm doing that. But so much of it is generic, and there's nothing you can do about it, other than try to change a lot of the things that you're doing. And for me, that means less medication, more natural things, better food, less alcohol, and everything else that I'm doing. I'm waiting to see if the numbers change. So in another couple of months, I'll be checking on those numbers again. But the point I'm trying to make is, finally somebody ordered more tests where I can see what's happening. And I don't understand why. I mean, I've seen some of the best cardiologists on the planet, and no one has ever asked for more tests. They're just very happy giving you statins. So thank you, everybody.
Oh, thank you, Joseph,
Yeah,
for
thanks,
sharing.
Joseph.
Thank you. Well, let's go to the next question, which we want to discuss. That I think Brian has seen, I have seen, Mark has seen that people are perfectly normal. They are fine. And that's the reason we said that I'm fine. Like, and then they suddenly are into heart attack and ER with stent. So, as I think Joseph truly shared, that we just do the basic lab work, then inflammation and plaque activity is never done. Then calcium scoring, because calcium scoring, like your cholesterol may be normal, but your calcium score may be like 300,000. I see that quite a lot of time. And then right now, again, the problem is that when people do calcium scoring, the way they go to their cardiologist, they say that, oh, wow, everything is fine, nothing is wrong with you, and just take a statin and you will be fine. And I think Joseph shared that even after taking statins, people are getting. So there are a lot of cases we see. So what I feel is that, and labs are like checking the gas tank, but the heart disease is often in the engine, in the pipes. It is hidden, and that's the reason getting into calcium scoring and the advanced panels is very, very important. So I'm again throwing open if anybody would like to share their views, ask questions.
I think my case was a little bit different because I found out that I had a serious blockage, and I just had the feeling that there was something wrong. So they finally did the test and found that out. So looking back, it's like everything else seemed like it was okay. The cholesterol. And so what's the sense, like, what else can I do? I'm doing what I can, and yet still maybe I feel dizzy or something feels like it's not quite right. And cholesterol went up with this statin.
I mean, I think what you described is primary care medicine, and it's why doctors don't stick around in primary care medicine. And I mean, to me, it's the greatest show on earth is people, and I can see people on the screen. Some of you know, I know, and some of you I don't know, and my nephew and
Yeah, Matt
people,
is-
right. Anyway, there's, you know, we in medicine, and I do like to banter about this with Brian, with Pratiksha, with whoever will listen, but I mean, we think we're scientists and this is a science, but the truth is so much of it is an art, and we don't know how to predict really anything. Because I mean, we can try and it's fun, but what is it that really, you know, I think most people want long life and to prosper and to be happy. And I think that's actually the most important thing, is to be happy every day and right now, because that's all you can really control. And yes, Julie, yes, symptoms matter. And right, when you went through a ECP and you still have you have something, but then, you know, dizziness can mean literally a million things. And your dizziness is not Barry's dizziness or Joseph's dizziness. And so, yeah, it's a very, this is life, and it's very interesting. And right, we want to be in control. And the truth is, that's, I think what everybody knows is that we're really not in control. And we just do the best we can and take care of ourselves the best we can, and do whatever feels, be how we build our team, build a support team, whether it's friends, family, doctors, whoever. But it to me, it just all comes from the heart. The heart is, to me, the most phenomenal organ. The brain is, of course, interesting too, but I think the heart has, it's what we associate with feelings and gut instincts and so many things, and it's just not as easy as a number. And actually, I think we delude ourselves completely by the numbers. And I think we should all, every morning when we wake up and every evening when we go to get ready for bed, I think it's reflection, and it's consciousness, and it's thinking about what do you want in this life and how do I get there. And that doesn't mean you're going to get there, but it is incredible, the human mind and the human heart, how you get to places. And I think this whole, what we're talking about as another way of handling heart disease, which is different than the American medical model, which to me, the American medical model is notably broken. So that's what I think Brian, Pratiksha, and I, and a lot of you are trying to redesign. What would be a good model? What is health, and how do we get there?
Yeah.
And so I know I go nebulous, and that you could say it's philosophy or it's being in the sky, but the truth is the sky is offers everything, and how do we bring it down into our own personal lives, and how do we help you get there?
I totally agree.
That's what I think of it when I go.
I agree with everything you say, but I don't want to keep feeling dizzy. So.
Okay, so you come to see me at 12:30 tomorrow. We'll figure it out. I think it has nothing to do with your heart.
Okay, so because I just want to just let you know that we are going to have a generic, because we cannot go into any specific diagnosis. So if you have any symptom, then please check in with your doctor. We can, so as he will rightly help you out. But just coming back to the conversation about the cholesterol, is that yeah, there is a number, but what we have seen that if you look at blue zones, especially the longevity zones in the world where people have lived for above 90 years, and we have our friend John, whose mother was also like having high calcium score and LPA, right, John? And then, you know, she lived very long. So there are a lot of other factors other than cholesterol, you know, and I feel that And that is what we are trying to do here, that having a positive community and support and feeling supported and willing to take that support, because we are living in isolation, we are living in loneliness, and loneliness is really an epidemic. And the reason we are doing this event every month is because we are bringing this community together. We want you to feel supported. Okay, so let's do one thing. We'll go into breakout rooms for 10 minutes where you can all, because when we introduce here together, it will be this 1 hour. But when you are into this breakout rooms, please introduce yourself and what are you currently doing to keep yourself healthy and fit. Please share amongst each other. And if you have done, some of you have already working with us or have done ECP or something related to your lifestyle, feel free to share what you feel. Just connect and just be open, and uh, please enjoy your time to with each other. So I'm just like uh, doing these rooms, and we'll meet back. Okay, break out again back to the main thing. Awesome. So anyone wants to share like some feedback, please, one representative from each group can show up and share. Please unmute yourself and go ahead.
I was in group 4, and I
Uh-huh.
basically explained to one other person that was on board that I am undertaking ECP and why I did it. And 42 years old, so he's a young guy. And I said, well, I did it because I think it's a good preventive medicine process, and I would like to be able to do as much preventively as I can, and ECP just seemed to be right for me.
Ooh, thank
So,
you, Joseph. Yeah.
so if he attends the course, the process now, I want 5%.
Oh, sure. There you go.
No,
Yeah.
I'll gladly do it. I'll gladly do it.
Good. Yeah, if you want to live up to 100 years, we have got Dr. 𝐁𝐸. Yeah, he's running this Living to 100 club, He's a
Okay.
clinical psychologist. Yeah, cool. Okay, anyone else wants to share? Uh, please go ahead.
Well, I'll share. We talked a lot about lifestyle, and I shared my perspective as a psychologist and how important our attitude and outlook is. And lifestyle medicine, it affects cardiac health, but I think it also affects our brain health and our cognitive well-being. So, we kind of share different experiences and how we talked a lot about ECP and how I was so impressed that ECP can affect our cognitive functioning, not only our cardiac, but our cognitive functioning. So I think that's huge.
Yeah, you're right. And actually, Valerie, I don't know whether she wants to speak up because she just gave us a recording yesterday that she was sleeping so well like a baby and having all these dreams, and her blood pressure is totally under control. And even though after 3 months she has finished the sessions and feeling more energy, more relaxed, and all that stuff, So, yeah. And so we have got some people post retreat over here, Jane and Joseph and John. So, would you want to share some breakthroughs? Like you guys are now 2 months. So, Joseph, you wanted to be on the spotlight, right? You want to share what happened?
I give myself a 50% grade. I am doing the things that are practical in terms of changing my diet. I am not doing so well on spiritual things or relaxation things. I was never in what I call foo-foo dusting. I'm sorry if I didn't mean to offend anybody. But I just, where I can absolutely relate to exercise and eating, I have a harder time working on my brain and meditation and all the other things that we learned there. So, but I'm very happy with my 50% grade for the moment. I figured I can only conquer so many challenges at one time.
You lost 20 pounds in 2 months, right?
I've lost 20 pounds, yes.
Yeah. So that's the big thing with the
Yeah.
with the change in the diet itself. Yes. Anyone wants to share?
I bumped into Joseph
Hi.
but yesterday or the day before, and I was like, you're a transformed human being. I mean, to me, it's the 20 pounds, but the light beaming from you and your eyes. And to me, even though you're saying that you feel like it's only 50%, it feels to me like your energy is so much more open. So I feel that the transformation has happened on many different levels, even though you're thinking that it's only happened on the food. I congratulations, you're an inspiration to me, really.
Thank you. We love your place.
I want to give you guys a little tough love out here, because I have been watching all of you grow and blossom in front of me. You guys are doing so well than what we met at baseline. But and this is like a little bit a psychological thing which we have to see typically when we are heart prone, is like half glass full or half glass empty.
Yeah.
What I would say is that celebrate that half glass which you have, keep a awareness of what is missing, but let that not be your bigger picture or focus, because whatever we focus on expands. So if you will focus on that, wow, I got this thing down and this is great, and like that will grow. So always focus on all the good things which are happening with you, and make it a part of your thinking process. And the more you will do that, that will expand. Okay. So watch the quality of your thoughts will determine the quality of your life. So always see what you think. And I just, like, we were talking about getting tired, because many people, as they age, they feel okay, they're getting tired. So what could be like toxins and heavy metals and infections and all those workup is there, which is there. But these are just some points which I thought of sharing. So what we have to look is into the cellular energy and mitochondrial health, because mitochondrial health is definitely never seen into the standard care. So, and actually nowadays there are even tests available if you want to do the mitochondrial function and everything. But also looking into, like, if you guys are monitoring your sleep through an aura ring and all, getting restorative sleep is very important. Like, it is like people are sleeping for 8 hours, but then if you don't get REM sleep or deep sleep, which is very important, when you get deep sleep, that is the time actually your body is repairing and recovering. So doing sleep studies, whether there is a sleep apnea or how you are sleeping, I think sleep is a very important foundation. And I think I'd already told before, but if you want to read this book, Why Do We Sleep by Dr. Matthew Walker, I think it's a great read. And focusing on getting good quality sleep is very important. Then, of course, having good vitamin B12, magnesium, CoQ10, these are also very important. They can be nutritional deficiencies. And many times we have seen that there is insulin resistance. Actually, in standard care, they never measure insulin resistance or endothelial dysfunction and all those things. So there are a lot of things which can be there. And many times we have seen that in some, especially in women, that chest pain may not be the classical thing of a heart, but just fatigue or tiredness could be a symptom. And screening yourself for that is also very important. So I would just like to throw open if anyone has any questions and share. Yeah.
Julie?
Yes.
Oh, okay. Well, since I have completed 36 sessions of ECP,
Yeah.
I can tell you that my energy level totally changed.
Wow.
One of the things before I started was low energy, and that was one of the things that was bothering me most. I couldn't interact with my grandkids. I was just feeling just dragging, even though we have great diet and exercise. And after ECP, is totally different. So I applaud you and appreciate you so much.
Thank you. Thank you, Julie. My tough love worked because when I was saying half cup full, you immediately you're an action taker. So I'm so proud of you, Julie. Thank you.
You know, as Julie's walking partner, I can attest to what she says, because we have a lot of inclines around here, and twice a day, or maybe 3 times, we'll go for a walk, and we would have to stop on hills. We'd be 1/3 of the way up in our neighborhood, and you know, as much as I like to walk together, it was like, it was tough to really enjoy those walks. And I was hoping so much Julie could make progress and be able to, you know, effortlessly, or at least with reasonable challenge. And boy, now her pace is amazing. I have to actually perspire a little to keep up.
I don't
She's
even
endorsed by her husband, John. That is
Yes.
good. Okay.
Yeah, I've told you about that.
All right. Thank you, John. That's sweet. Cool. John Irv, you're not speaking, my brother. What happened? Why you're so quiet
Well,
today?
I'm just listening, but
Yeah, tell
I
me.
mean, I finished the EECP in April, so I've been doing my exercise. I still haven't done this VO2 max test. I think that's going to be, for me as a scientist, that's what I sort of want to see, but I've been sort of holding off. I'm giving the few months for the heart to sort of develop its extra vessels, and then I'll do that test, and then I'll let you know. But I guess I have noticed the REM sleep. It depends on the nights. I mean, there is some variation, but the REM sleep has gone up a little bit. I mean, you mentioned the deep sleep. That's the one that is always the lowest for me. So I'm that it didn't like jump out magically after I did the EECP. So I'm still, I guess I need to read that book, Why We Sleep, and see if I can find any practices. But I do try to have a nighttime routine where I try to settle down, and now I start to go to bed now at 10 o'clock, which is certainly earlier than I used to. I think the other thing that I'm looking forward to starting, as I mentioned during the workshop, the thing that really sort of excited me was the breathing, the power of the breath. And I was able to find that there is a yoga course just 5 minutes from where I live that will be starting in June, focusing on this, is it Kundalini breathing? Yeah, Kundalini breathing. And so I'm looking forward to starting that pretty soon. And maybe that will affect my sleep in a positive way.
No, definitely. So I think John Briggs has deep sleep. That is what I have been told. And for me also, my 25% is deep sleep. And I can tell you one thing for sure, that relaxation and meditation has a role, because if you're training your mind to relax and your body to be relaxed, then your deep sleep becomes better. And that is the reason what I'm sharing with you, all the time-tested tools of non-sleep deep relaxation, meditation, affirmations, and all those things are very important. So if you can just even start 2 minutes, 5 minutes, just make it a habit, like even deep breathing, like, left nostril breathing. These are all the simple tools. Just start doing it, because there is a power over there, because we have to train our mind to relax. All right. So we are going to the last 5 minutes of our session. And
I think someone got a question in the chat, Dr. Gandhi.
Oh, there is. Thank you, Runiva, for. Okay, so activate stem cells. Yes, Brian, you want to tell? Because I don't know of much evidence with stem cells, to be honest. So
yeah, I don't really know either. I did just put this in open evidence, and it doesn't seem to really help me much, honestly. The open evidence answer, it says it is not a recognized term. There's something called stem regenin, REGENIN, which is a small molecule antagonist, blah, 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 blah. The answer is so medical that it just doesn't even make any sense to me.
Yeah.
It was pretty unhelpful looking that up. The answer is not in open evidence. I would have to, it's probably a term, I assume it's a term for some sort of supplement, perhaps, that's a trademarked name. I don't know. I'd have to.
Yeah, I mean, I've been into this research for the stem cells since more than 20 years. And you know, Grant, that you go to the heart muscle and inject there, and like all those things which we have done. But at least till now, I have not found any convincing data or evidence to confidently say that, okay, do this stem cells, and then we will be having this kind of 100% benefit, or at least knowing the outcomes clearly, at least to my knowledge. So
Pratiksha,
It is the trademarked brand named product. I don't know. I'll be honest, I'm skeptical of all these supplements that people sell you. Unless there's science, unless I've read a paper that shows that it makes any difference. I mean, you can try it. I wouldn't bet my health on something like that.
cool. So I just want to give a final takeaway, because some housekeeping. We will be doing this every month. So it's an event where me, Mark, Brian will be having more guests. Will be there. You are free to join every month. Bring in a guest if you feel, because the goal here is we want to build a heart health community. We want to go off record, because when we meet doctors in primary care setting or the cardiologist with the insurance framework, we are not having to able to talk heart to heart, and neither are people able to. What we are creating here is beautiful relationships, bonding, and there are already like Jane, Joseph, John. They are all have been there, in the retreat. We are going to like have workshops and events. We are going to have a workshop coming up in June. We will be sending you the invitation, and we are going to have our major retreat in October. So please share this with whoever you feel will want to have this information. And my final message is, and I'll tell everyone, is that open your heart with love. That's most important, because in yoga we call the heart chakra. There is a cerebrospinal center, and when our heart chakra is blocked, that is where all the heart problems, blood pressure, and all those things happen. And when I talk about love, I'm not talking of conjugal love or parent-child love. It is what is the universal love which we call. So just open yourself, and you can start very little, like simple things. When you're going on the road, you see someone who is not doing good, like especially nowadays this homeless situation is very common, like just give that compassion, that love, like to whoever you feel needs it. That is an act which is totally unconditional. So make it a part of your daily life, and just see how your heart chakra opens. And then you see that how it benefits your life. So with this, I will let Brian and Mark give closing comments, and invite if anyone wants to share anything. Yeah.
I love that idea. I like love and forgiveness, and I think, I work in the world of standard medicine, and I like all of that it can offer, but I think we all can offer ourselves really good things every day. We can look in someone's eye. We can make peace with someone that we're at odds with, and we don't need that person. I mean, we could just make peace with them inside ourselves. And I think there's just so many good things we can do for ourselves, and being connected and being at peace, I think, is the path. And that means a different thing every single day, and different mechanisms. But I wish you all well. I enjoyed today, and thank you so much.
And I've dropped in the chat that what is your number one takeaway from today? Just type in till Brian has his closing comments, and I'll leave the floor open for anyone if he wants to interact. Yes, Brian.
I agree. I don't know what else to add. I shared with the people at the retreat earlier this year that one of my medical mentors said that the only thing that really matters at the end of the day is who you loved and who loved you. And I think that that is true. And I don't know why we continue to lose sight of that fact, but we do. We just, stuff, fame, notoriety, money, all these things that we're told matter, and they don't. But it's hard to keep remembering that. I think we need, is one of the things I love about a group like this, is that we can continually remind each other.
Yes, thank you. And I think this group is one of the rules we have, is like having that open heart and unconditional love for each one of you. And this is a kind of a gift of our time, which Brian, me, and Mark, that is every month, we just want to share ourselves, totally no expectations, and just be with you guys to support you in whatever way you can, or bring your friends or anyone you feel. Because I feel that, as Mark said, Brian said, we have been into practice more than 30 years. We have seen it all. Now we are in a phase of life where we just want to be working with people who are proactive and want to feel connected and work on their health, go to the root cause and do the right things. So thank you very much for today. Our next event is going to be on 3rd of June. We'll send you the details. And thank you all for Jane. When we enhance our health, it uplifts each other. Great. Thank you, Rajni. Ashok, cholesterol numbers are good does not mean that you're safe from heart problem. I think that was a big takeaway. Then heart disease is 90% preventable. That's good. James enjoyed the group. That's nice. And Dr. Fair is lifestyle and positivity. So thank you so much for wholehearted participation. And feel free to stay in touch with us, connect with us, and wish you all a wonderful evening. Thank you, and bye-bye.